Good afternoon. It is 12 noon, and we want to welcome you to the 8th webinar in the series Flint Community Webinars on Coronavirus. Again, my name is Yvonne Lewis. I'm the co-director of the Healthy Flint Research Coordinating Center. And the Healthy Flint Research Coordinating Center is a multi-institutional partnership that is led by a strong community core, academic partners from the University of Michigan Flint, University of Michigan Ann Arbor, and Michigan State University. We are just so excited that you all have joined us today, and we're looking forward to an exceptional webinar today. I just got a note, this is wonderful because we're working in real time. Just got a note that the Congressman is a little bit delayed, so he will be on shortly. But for those of you who have joined us for previous webinars, we're glad to have you again. And I just want to remind you, especially for those of you who are joining for the first time, to be aware at the bottom of your screen, there's a Q&A button. And we certainly want you to be aware that you can go to that Q&A button and put in any questions that you may have. We've had a number of wonderful community partners who have committed their time every week for the last 8 weeks to be on with us. And we want to certainly appreciate them today. Just want to go over who our community partners are. And some of them, we may have missed a few names today because we had some changes, but we want to appreciate those who are on the line today. We have with us, excuse me, Dr. Susan Wilford, who's from the University of Michigan in Ann Arbor, Dr. Deborah Holden, who's with MSU, Michigan State University, Suzanne Cooper from Genesee County Health Department, Billy Mitchell from the City of Flint, also Dr. Lawrence Reynolds, who is a health advisor for the City of Flint. Renee Kennedy has been one of our weekly representatives who is representing the Michigan Public Health Institutes for the state, Anita Stewart from the Flint Community Schools, Clarence Pierce from Hamilton Community Network, Isaiah Oliver from Community Foundation of Greater Flint, Jim Melanowski from the Genesee Health Plan, Afton Shavers from the Greater Flint Health Coalition. I also see Nicole Smith-Anderson on with us today from the Greater Flint Health Coalition. And we have Tricia Hill from the Genesee Intermediate School District. And also to join us today is Sharonda Grigsby from Michigan, the Michigan Department of Health and Human Services. Wanted to take a little bit of time to list them, and there are so many others who have committed to this work. We want you to know that these are voices that are working consistently behind the scenes and in front of the scenes to help you, those of you who are participating, in all of our community members, get information that can be used right now. One of our goals for this webinar is that you will be able to hear, yes, the global picture about what's happening with the coronavirus pandemic, but also what's the local context, what's happening here in our local community that's making a difference for us. So these insights that you gain through this webinar, many of you have told me that it's been helpful to you, and we want to continue to bring relevant information on a weekly basis. So again, we want to acknowledge all of you that have made. We also know that this week, we also see Dr. Tupper from Hurley Medical Center has come on board to join us today. Thank you, Dr. This is a wonderful, exciting week. It's Mother's Day, and mothers, and we recognize this is a little bit unusual time because mothers are sheltering in like mother babies during hibernation. But we want to give a shout out just to families today who are figuring out how to work through this challenge and make sure that their families are well. Is important to you. And you can do that by filling out the survey at the end of the webinar. So when you fill that survey out and you let us know what is of interest to you, we'll do our best to make sure that that information comes forward to you. Again, we have joining us today many of our community representatives. So we're going to make a quick shift. If you could, my helper in the background, we have a team of Michigan State and the University of Michigan that's working to make this happen. So I want to go quickly. If we could go, Suzanne Cooper is on the line with us in the webinar this afternoon. And one of the things that we heard about the work that she's doing, and she is really making an additional commitment to be here with us today. And Susan, we appreciate you being out and about in a contained place just so you can be sure to be on this webinar today. So we want to utilize your time well and ask you to give us an update on what's happening. We've talked about our testing sites, but we want you to, if you would please, give us an update on what's happening with the health department and the testing sites.
Okay, so as of yesterday, when we posted to our website, we had 1,732 positive COVID-19 testing results in our community and 212 deaths. A reminder to everyone that this is not likely the true number of COVID cases in Genesee County because of limited testing. That is why getting testing more available in the community is so important. A reminder that though the health department's McCree South building is closed to the public, we are still providing service, so don't hesitate to call if you need something. And our Burton branch office is open by appointment only for WIC services, for family planning, immunizations, and sexually transmitted infection testing. So all of those services are still available, but we are having some of our staff work from home so they can practice social distancing, as well as some of us being in the office to make sure we're available to serve you. We have been able to add a couple of additional testing locations in collaboration with the City of Flint, Michigan Department of Health and Human Services, our Genesee County Emergency Manager, and other community partners. So I want to announce that Rite Aid in Flint on Clio Road will be opening a testing site on Monday. Their hours of operation are from 10 a.m. to 8 p.m. Monday through Friday, and Saturdays and Sundays from 9 to 5. This is wonderful news in that now we'll have a testing location that is open in the evening that allows for more flexibility for some of those essential workers who are working during the course of the day to be able to be tested. We also want to announce the introduction of Kroger to the testing community. They are going to be providing testing at the Grand Blanc High School parking area, and they are going to be available again on Mondays through Thursdays. And again, both are by appointment. For the Rite Aid locations, you would contact through the Rite Aid website, and for the Kroger, you would do the same, and we'll be able to provide that information so that you'll have the flyer for the future. But know that those two are our newest sites. Again, there's a Rite Aid in Swartz Creek that's offering testing. They're offering testing 9 a.m. to 5 p.m. daily by appointment through the website. Hamilton Community Health Network continues to offer testing Tuesdays and Thursdays from 10 a.m. to 4 p.m. at the North Point Clinic and at their Burton location. And then Michigan Health Specialist is providing testing at their locations, the one in Center Road in Burton and also the one in Robert T Longway in Flint. Genesee Health Systems is also providing testing, though not open to the public. We want to acknowledge them because they are doing mobile testing. So they are taking their units to assisted living and group home settings so that those individuals in those settings can be tested as well. So thanks to all of our partners, we continue to work to identify new testing locations, and we will be providing you updates as they come on board.
Suzanne, thank you so much for that. We talked a little bit earlier, and with these new sites coming on board, and what you're looking at, if you're watching the webinar right now, you're looking at the current sites. There are sites that are going to be opening. We'll have this information up and available for you in the future webinar. Suzanne, we appreciate you letting us know because you're saying that we're going to have sites opening up on Monday. And so those of us that are listening, we're going to just tell you that one more time so that you can note this, that the testing will begin at Rite Aid in Flint on Clio Road starting Monday. Is that correct, Suzanne?
That is, and again, this is exciting news because it's another location in the city of Flint that makes it more accessible so that we have access for everyone to testing, but also because they're offering hours from 10 a.m. to 8 p.m. Those evening hours allow for more people who are working to be able to be tested.
Another important thing that we're going to spend some time again in a future webinar is talking about some of the shifts that are happening in the protocols for testing as more opportunities become available. So Suzanne, can you give us a little bit of a tip on that while we're listening? We're going to stay right.
Yes, so again, much of the testing is done by availability. So access to the testing materials and also the personal protective equipment that allows for those tests to be conducted. And the priority list is still focused in on symptomatic individuals, healthcare providers, and first responders. And those that are in congregate settings like the long-term care facilities, jails, shelters, and group homes, etc. But there is more availability of testing in the fourth tier for those asymptomatic essential workers, the people that are going to work each day in grocery stores, gas stations, health departments, universities that are providing services. Just recognizing that those people are still working, and we do want them to have access to testing. Again, they're working during the day, so this Rite Aid location in Flint is exciting news in that they're offering testing outside the normal 9 to 5 hours. So anyone who is an essential worker who is asymptomatic or symptomatic can now get testing at those two locations. The new development with both Rite Aid and Kroger is that they are not requiring a doctor's note in order to be tested. So that is something new, and that has that's true of just the Rite Aid and Kroger locations. Hamilton and Michigan Health Specialists will still do the testing by appointment, but they are requiring a doctor's note.
Thank you, Suzanne. And we're going to stay right here with this slide but you've given us a good segue. I want to remind you, for those of you that are on the webinar today, our guest speaker is coming. He's gotten a little bit delayed. Our guest speaker today is Congressman Dan Kildee. And we all know that Congressman Kildee was born and raised here in Flint, a lifelong Michigander, and he's proven himself to be a real advocate for our community. So we really want you to stay tuned, and if you can, send out a note to others and ask them to join us. He will be joining us shortly. While we're on this slide, I do want to shift a little bit and ask for an update from Clarence Pierce, who has joined us on the line. He's the CEO of Hamilton. So Clarence, can you give us a little bit more insight and tell us how your first week went with the testing?
Yes, well, things are going well. Yvonne, it's good to be with you, first of all. But things are going very well. This was our second week. We brought our Burton location on this week. We tested on Tuesday and Thursday. We have seen a fairly significant increase at our North Point site on the north end. Burton, the first day on Tuesday, we saw about 12. Then on Thursday, that jumped up to about 20. And next week, we hope to start getting closer to that 50 a day at both of our locations. So far, we've had good participation. We have filled the schedule, and we would hope that we get to a point where it doesn't matter about the symptoms, that we will be able to test you regardless. I know Suzanne just mentioned that 2 of the locations will test you without having a doctor's note. One of the reasons we have that process now is it helps us to coordinate things and organize better. We actually set up appointments so we know you're coming, so we have everything ready. And when you pull in, it's just a matter of doing the test and you can pull out. So that's going well, and I think we'll continue to see things improve. And we're happy to see that these other testing sites are coming on board. It's
Wonderful.
joy to see.
Thank you. And my goodness, I look here and I see our friend Congressman Kildee. Good afternoon.
Thank you.
It's a pleasure to have you here. And again, I was sharing with our listeners before I saw you in the queue there that you've been a lifelong resident of born and raised here in Flint, lifelong resident in Michigan, and you've worked at many levels right here in our city and in our county. Now you're at the federal level as the Chief Deputy Whip of the Democratic Caucus in the House of Representatives. How amazing is that? I want to shake your hand when this is all over. We welcome you here today, and we just want to open now. Dr. Tupper, if you stay with us, we're going to come back, but if we do want to give Congressman Kildee an opportunity to share with us this afternoon all the work that's being done and key highlights that he thinks is important for us to understand as the Flint Genesee County community.
Well, first of all, thank you for accommodating me. And I had another sort of Zoom meeting that went a little bit long. This is kind of the way it is. I never imagined that when I'm working from home that I could actually be late for meetings, but it's working out that way. So I'll just take a couple of minutes and try to keep you all on schedule and maybe answer any questions you might have. But my priority, has been getting resources for Flint, whether it's through the Flint water crisis. And by the way, on that point, we all need to continue to push. We're working right now to get the Flint registry reauthorized for a longer period of time. That's a part of our work. But whether it's in that space or now dealing with this COVID-19 crisis, what I'm trying to do is make sure that our residents have both the health support that they need. And we were just able to announce some grants to support testing, which I know you were just talking about, a critical piece of all of this. But also the financial support that people need, the economic support that they need in order to follow the medical guidance that they're being given. And we have to also recognize the disparity. And I think it's really important to note this, and I'm pleased that Michigan, at least Michigan, is taking note of the fact that there's dramatic disparity in terms of the impact of COVID-19. It comes as no surprise to us because a lot of the people on this webinar have been in the front lines of fighting the battle to overcome health disparities that disproportionately impact people of color and people facing other issues. The more marginalized populations are at much greater risk. And because we know of what the history of our own community is, we have a significant population who is at much greater risk as a result of those risk factors. So at least in our case, we are taking note of that. What's been frustrating to me is that some voices have suggested that because those disparities are the result of long-standing issues that will take a long time to address. I get that. But that doesn't mean there's nothing we can do about it. That doesn't mean we can't focus and concentrate resources in the moment to try to minimize the negative consequence of COVID-19 on communities that face greater risk. And that's why it's so important to get testing. I was really happy to hear that there's an increase, but we need to dramatically increase the amount of testing that's available so that we are armed with the information that we need to protect ourselves, that we have good data. In the state of Michigan, 14% of the population is African American. A third of the cases are African American, 41% of the deaths. I mean, that data is just stunning. And so what I've been working to do is frame the response consistent with the challenge. And what that means is targeting more resources into those communities like Flint and others that are facing the unique challenge of having a high number of people who are at much greater risk. And we've been doing that, but we need to do more. This is at once a health crisis and an economic crisis. Mm-hmm. And the data shows us that the people who are least well positioned to manage either aspect of that are the people in our community who have the greater health risk and because of the nature of our recent economic circumstances, are struggling financially. So we're going to continue to push for more financial resources and more health resources. And that's the target. That's the goal. And that's why I'm happy to be on with so many people who have made that their life's work. So thank you, Yvonne, for including me. Happy to take any questions that you might have.
Well, actually, we want to just go to the next slide and you'll see some of the questions that have come up. Wanted to ask you if you could give us some insights on the legislation that's going on with PPP and those kinds of things, so that we can be really clear and hear from you what this actually means.
Sure. Yeah, I mean, just if you want me to address the PPP issue or the legislation in general,
yes.
I'm advocating in the next bill, number one, to get far more financial support for the state governments, because if the state government doesn't get their budget hole filled, that's going to cascade on down to the communities. Like I had a call yesterday with Dr. Beverly and her team at Mott Community College. If we don't offset the state financial losses, those losses are going to be passed on to Mott Community College. That means fewer opportunities for the people who attend Mott Community College. We can't let that stand. So that's a big piece of what we're doing. But I'm also working on other aspects of this. I have legislation that would extend the unemployment benefit until the end of the year, the supplemental unemployment that people are receiving now. It's been a pain to get everybody in that system because we have 1.1 million people in Michigan who have filed for unemployment. But we can't have that end on July 31 because the economic crisis and the health crisis will still be ongoing. So my legislation would push us to the end of the year and afterward for that unemployment benefit. And then on the Paycheck Protection Program, which is the small business support, I support the program, don't get me wrong, but it's not hitting its target the way it should. And so I've been working with Senator Cory Booker from New Jersey and one of his colleagues, Senator Steve Daines, who's a Republican from Montana, to create a Main Street Relief Act, which would put money into the hands of locally managed relief funds to support those really small businesses that are getting overlooked. The barber shop, the beauty shop, the coffee shop, the small restaurant, the Molly Maid franchisee that don't have a banking relationship that puts them at the front of the line, even with the targeting of the last round of money around CDFIs and community banks. There are still going to be small businesses that are left out. So we're working to fill that gap. That's sort of where things stand right now. And then significantly increasing the amount of money for testing, contact tracing, isolation, and support services for people who are identified as COVID-19 positive. That's really the focus.
So when we're looking at the overall economic impact and you're trying to address these, what do you say to us as community residents? What are the things, and small business owners, what are some of the things that we can do in the interim while we're waiting all of these things to happen legislatively?
Well, I think for one is to educate the community on the tools that are in place right now, even though, as I said, I don't believe they're entirely adequate. But there are some tools that are available that just require folks to get comfortable with how they seek them. And the Paycheck Protection Program is probably a good example of that. Mm-hmm. But there are folks, for example, that might have filed for unemployment and got denied. And you know how it is when you're sort of used to getting denied, you just assume that's just your lot in life. Well, we've made some changes to this unemployment program that basically includes everybody. And even if you get no for the answer at the first stop, don't stop there. Call my office. Let us know. We'll help you navigate that process. And I think right now, that's my bigger concern, is that there might be help for some folks who, in a community that has been through its trials, are so conditioned to the help not being made available to them that when they get that first door closed in their face, they don't bother to knock again. And I want them to call us and we'll help them knock that door down. We can get the help. We just need to make sure people know that it's available and don't take no for an answer.
I do think that's really important because we personally, and I know some of the outreach workers and navigators and even the organizations, we've gotten calls from people that said, I didn't even know how to fill out the paperwork because it's a little bit different now. And so, as you mentioned, these conversations for us are important. So we can say it is important for us to continue to make those efforts, to knock on those doors, fill out those forms. Even if you have to fill them out more than one time, let's get that done. So it can make a difference. I have a question here in addition to these questions, Congressman. I'm going to look here. There are people who are concerned about the threats of incidents of violence and those who are working and shopping. And you've heard about what's happened here in our community. What would you say to us? And is there something being done legislatively to protect the safety of those who are working in our community?
Well, that's a really important question, and I'm just brokenhearted from what I've seen. You know, the case at the dollar store being an example, but we've seen others. Actually, I think one of the things that we have to do is we have to call out the leadership in this country for creating an environment where that violence, I'm not saying they condone it, but there are some national leaders who create the environment where that sort of thing is more likely. And even some of the folks in Michigan who have gone to the state capitol carrying AR-15s and AK-47s, I think help contribute to a culture that says that there's, you know, that it's okay to foment violence if it's an advancement of some principle. Well, I can't figure out what principle they were trying to advance by walking into the Capitol, talking about whether or not they should be able to go on a motorboat ride or plant their flowers with an AK strapped to their back. I mean, they have to take some responsibility for the messaging that gets sent. But I think ultimately, you know, it comes down to all of the interventions that we all know are important become so much more important when we're all in stress and facing a crisis. So I don't think there's a silver bullet, if you don't mind the use of the term. I don't think there's a magic solution. I think it just means we've got to do so much better to care for one another and not put people in a position where they feel so desperate that that's the only resort they have.
Yeah. And this is a very sobering moment because it requires us to think a lot differently than what we have, because we're not only being concerned about ourselves, but we have to be concerned about those who we come in contact with, because we don't know who is exposed, but we may not even know because we're asymptomatic. But then the pressures that we have really create a different environment for us and added concern. We have another community group, population in our community that has great concerns. And these issues have added additional pressure for them. And those who are our undocumented residents. And so one of the questions we have, is there consideration assistance for our undocumented residents in the community? And what is being done on their behalf, if anything?
Yeah. Well, one of the things that we've insisted on in all of the House legislation, and again, I'm talking only for the House of Representatives, these things have to get to the Senate and through the Senate, and the president has to be willing to sign them. But we have insisted that that immigration status, that legal status, have nothing to do with any of the COVID-19 response. Personally, I'm of the view that that's a principle that ought to apply more broadly. I mean, we all, depending on your beliefs, we're all, you know, God's children. We're all, you know, inhabitants of the same planet. We all share the same space. And the idea that the location of somebody's birth somehow changes their basic essential human dignity is an affront to everything that I believe. But specifically on this issue of COVID-19, we are insisting that there be no conditions applied to any of the resources. Now, we've had to default to the argument that is not the moral argument. I believe it based on moral principle. But the argument that sometimes has to be used is that it's in our interest. I mean, if we don't get help in the COVID-19 crisis, to everyone who is a potential carrier of the virus, no matter what their immigration status. We put everyone at risk. Now, do I like that argument? Not so much, because there's a moral imperative to me that is so much more important. But for some people whose ears are deaf to that argument, we have to use an argument that works for them. And I think we have to tell them, look, if you somehow think that you're safer by denying support for people whose immigration status may be questioned, if you think you're safer, that somehow you're going to be immune from infection from somebody based on their immigration status, you better think twice.
Mm-hmm. Another question for you, Congressman. It says, I am receiving calls from community members who are not able to pay their rent or pay their bills. Also, what can be done about assistance for the minority-owned businesses?
So I'm starting with the last piece. The legislation that Senator Booker and I are drafting and hope to have included in one of these bills is really intended to get at those Main Street businesses that very often are minority-owned, women-owned businesses. And just to tell you a little bit about how that will work, we go around the banking system and go straight to a community-operated relief fund. So we don't have to go through the charade of underwriting a loan that's going to later be forgiven. So I think that's kind of a critical variable that we're trying to implement. What was the other aspect of the question I got?
What about minority-owned businesses? What's being done to?
Yeah, well, that relates to minority-owned businesses, but the first part of the question, I guess I missed.
Okay, the first part of the questions. The first part of the question says, I'm receiving calls from community members who are unable to pay their rent.
Oh, yeah. Yep. So that's a big issue, obviously, because not everyone's been able to get connected to unemployment. My legislation would increase the number of people who would be eligible so that people who have not been in the economy would still be able to get that help. That was one way. But I've been working with Congresswoman Maxine Waters from California, who chairs the House Financial Services Committee. I was her number 2 Democrat when I was on that committee for 6 years. We have legislation that we hope to include in the bill that will be considered next week that would provide direct funding for tenants and people who have mortgages, but specifically it would include tenants and in some cases the owners of those properties, so that we don't put people in a position when they can't pay their bills. Even if we get them forbearance, in 3 or 4 months, if they owe 3 or 4 months of rent, forget it, game over. They're not going to be able to catch up. So we have, it's going to be a couple $100 billion, if we can get it in the legislation, money that would pay the rent for those people during this period where they can't, so that they don't set up a situation where in a few months when the crisis is over, hopefully the crisis will be over, but in a few months, they're not just in a worse position than they are right now. We've also been able to get some traction around water shutoffs and providing money for people so that drinking water is available. And my office on a case-by-case basis will also help get people help with their other creditors. Very often when we talk to somebody about their unemployment, we can help them navigate that process. And they say, but if it's going to take a couple of weeks, it's going to be too late. Sometimes we can reach out to those creditors and say, just let's take a pause here. So again, reaching out to our office is one of the ways to deal with that.
So you've given us the opportunity to reach out to your office, and we're going to get your office number so that we can include it in our conversation for today and make sure. And I know you have very capable staff. They've been communicating with us throughout the day, and so we want to make sure that our listeners know today that you're welcoming them to call your office and talk to the staffers and get information to you as readily as they can, so that you can provide the support you need. One last question or comment. Some of us are concerned, and this was one of the questions, the concern about our legislators, because with all the things that happen, your lives sometimes are put in danger. when you spoke about what was happening at the Capitol, individuals going in there armed. We want to make sure that our legislators are safe as well. Can you give us some insights on what protections are being put in place for our legislators?
Yeah, that's a good question. I mean, this is a moment where everyone's under a lot of stress. I know in our case, we've been working from home, which I thought, at first, like I said, I thought that would be, wow, this will be great. I'll be able to work from home. It'll be easier. It's harder. I mean, I like being home. It's nice to be here in Flint, especially, but it's tough to keep up. But that has kept us somewhat safe. I mean, the bigger threat that we face in Washington is right now there's a real spike in COVID-19 cases. So when I go to Washington now, I drive. I don't want to have to go through the airports. I get in my car, I drive 600 miles. I go straight to this little small place that I have there and go over to vote and come right back. But the Capitol Police have been great. And, in Lansing, we see these people coming in with guns. For goodness sake, we got to outlaw guns in the Capitol. Just doesn't make sense to me that you'd be able to walk in there with a machine gun, but you can't walk in there with a sign protesting machine guns. That's just irrational. And before I do want to get you that number so that folks can call my office, because we never really know our phone numbers anymore. I had to look up which one they should call. They should call 810-238-8627. I've got a great staff. We do incredible work. Basically, they've been working 7 days a week throughout this whole crisis. So again, it's 810-238-8627.
Thank you, Congressman. We appreciate you taking the time to be with us. And I know when we talked last week, you wanted to be able to be here for the whole time. And so thank you. We do have some other information that we're going to share during this webinar, but we want to let you know that anytime you have some information that you'd like to share with us, even today, we'll open it up back at any time for you to add a comment. So any closing statements at this point?
Yeah, I just appreciate all the work that people, I take a look at who's on the call, and it's really people who have spent their lives in service to other people, and it's just an honor to be a part of this. So thank you for allowing me to be a participant, and I really look forward to being able to see you all in person again soon.
All right, thank you. On behalf of all of us that are listening, Congressman Kildee, we thank you for the work that you're doing in Washington. We know without your influence there, some of what has happened in Flint probably would not have happened. We can just honestly say we know that your advocacy has made a difference for us. So we continue to keep you lifted up, and let us know how we can help you as well.
Thank you very much.
So if we just want to piggyback on this conversation from the federal level and know that there's been some activities at the state level as well. We just talked a little bit about the unfortunate situation that happened in Lansing a few days ago, but our governor has stood her ground, and she has maintained that there will be a continuation of the Emergency Powers Act of 1945. It's the Executive Order 2020-67 and 68 that will be in effect through May 28th, 2020. We were looking for some additional support from her staff, and I think they were trying to get on with us, but we just wanted to put this up for you. When you go on the webinar, and you can see there is a website that you can go on to look at her Michigan Safe Start Plan. We just wanted to provide you with the way that they're looking at it. 1, 2, 3, 6 items. They're looking at the uncontrolled growth. These are the particular things that our governor and all of her aides, she's listening to the science, she's working with the medical doctor and the epidemiologist to understand the uncontrolled growth of the virus in our state. They're looking at the persistent spread, looking at the flattening, if things are improving, how things are being contained, and then what will happen from a post-academic situation in our state. These 6 items you can learn more about when you go on the state's plan. It is a process, and I think the wonderful thing that our governor is doing is saying, let's continue to use what we know that has worked. We've seen a reduction in the number of cases in some of the areas of our state, but we're still not out of the woods yet. So she is encouraging us to continue to stay safe, to shelter in place, We know that some of the businesses, it's going to be a gradual opening. Some of the businesses, particularly our manufacturing systems, will be going to work this week, but we're encouraging you, when you're out in public, please do your best to stay safe. We want to go to another quick thing that was important about what the governor did, and Congressman Kildee mentioned this as well, and we came up in our questions. People are concerned about losing their homes because they have been out of work. The stay of evictions is still in place. This is another executive order by the governor. If you know anyone that is challenged with being able to stay in their homes, have them go on this website. Have them call the number that you see here on the screen right now, 517-335-7858, so that they can get some information. We don't want people to wait until it's already happened. They can start. One of the things, and I think it was important, prevention is really, really critical. Let's try to get ahead of this. We know that there's some challenges. Let's find out what we need to do to maintain our homes before we get into that critical situation. So we want to appreciate that. Another update from the state, Sharonda Grigsby is on the panel today with us. Sharonda, we're going to ask you to open up your mic if you have some additional insights that you want to share with us from the state today.
Good afternoon, everyone. Thanks for inviting us again to give updates from the state level. I just wanted to give a brief update. As you guys know, we're working with the overall task force at the state level. We're part of the Strategic Testing Infrastructure Work Group. I just wanted to give a report back on what the group has been working on. So the goal of our work group, the Testing Infrastructure Work Group, is to expand drive-through testing, and we're looking to scale up that to around 8 large testing sites throughout the state, with the goal of testing 500 people per day. We're also looking to expand walk-up neighborhood testing to about 20 sites, and make sure that those sites are accessible to vulnerable communities. And we also want to look at public messaging to make sure that messaging that we're putting out is being disseminated through trusted community voices. So far, what we've gathered and what we've been working on, we've identified additional sites. There are going to be 7 sites in Detroit. And then we've identified 13 walk-up sites across the state, and those are, walk-up and drive-up sites across the state, 13 additional. Those sites include Wayne, Macomb, Berrien, Kent, Calhoun, Chippewa, and Genesee County. Genesee County will have 2 separate zip codes. And then we're also looking at Muskegon and Saginaw. We just wanted to make sure that in all the work that we're doing, we're looking at the guiding principles and make sure that the data is the information and the work that we're doing is data driven. We're making sure that we're collaborating with our community partners to make sure that their voices are heard and they have a clear understanding of the connection with the social determinants of health. We're making sure that we're engaging the key stakeholders in the community and making sure that we're addressing the needs and concerns that we're hearing from them. And we also want to empower the community as the ambassadors to this information to help us stand up these additional sites to meet the needs of the community. So I know that's a brief update, but I just wanted to honor our commitment, come on and share with you guys what we've been doing in regards to the work that we're doing for the task force. I do apologize. I'll have to jump off the webinar after the update for prior commitment that we need to finish up. But I just wanted to make sure that I was here to give you guys an update on what we were working on from the task force level.
Thank you, Sharonda. We appreciate that so much. And we do want to remind you that application, that opportunity for funding is still available. So those of you that are interested, please go on the MDHHS website and look for that opportunity. Thank you.
I do want to add to that, Yvonne, we did post up frequently asked questions. So those were posted on May the 6th. We will be updating those questions on May the 15th. Agencies have until May the 8th to forward additional questions to Brenda Jagaday. So I just wanted to make sure that was available. So if people had additional questions, that they can access those frequently asked questions to maybe have some of their questions answered.
Thank you, Sharonda. And as you were speaking, we did get a few more questions for Congressman Kildee, and we see that he had to leave us as well. So Sharonda, we thank you for coming on, and we're gonna make sure that we address one of these questions. Dr. We have an epidemiologist, and there's some others who may be able to address some of these questions, but we will connect with the Congressman's office to be sure that we get these questions answered for you. If we can go back just a quick minute, I saw Dr. Tupper, and we were talking about, as one of our community partners, we were talking earlier about the testing. So Dr. Tupper, if you could chime in, we know that these other sites are available, but we want to get an update of what's happening at Hurley Medical Center. You could just stay right there on the side of partner updates. Yes, thank you.
Yeah, can you hear me okay?
Yes, sir.
Okay. We continue to see a flattening with regards to the number of cases coming in with the COVID-19 virus. We still have them, but it is definitely a way better environment than it was several weeks ago. So the cases are flattening in the community. Everyone is doing what they're supposed to do to mitigate the spread. And staying home and staying safe. One message I did want to get out there is don't, if you feel like you need to seek medical care, don't stay home. It is safe to come to the hospital. It is safe to set up either a telehealth or whatever format your doctor's office can see you, because we don't want to see any negative secondary effects of this pandemic, where people with heart attacks and strokes and other conditions, mental illness, are not seeking medical care related to fear of catching COVID, which I understand is a real concern. But coming to the hospital, we have a handle of this now on how to operate. We have great precautions in place. And so we want you to not stay home and have a bad outcome out of fear of contracting COVID. The second point of that is, I think part of the messaging early on in this pandemic is we simply did not have testing capacity. And so if you were only mildly ill with symptoms, the recommendation was to stay home because we could only test those that are severely ill. Now we have the testing capacity in place in the community. It continues to expand. So if you have symptoms of COVID-19, cough, shortness of breath, loss of taste or smell, even gastrointestinal symptoms, it's important to seek out and find one of those testing centers that we've listed in order to get tested so that we know and can further mitigate the spread in the community.
Thank you, Dr. Tupper. And it is extremely exciting for us to hear the collaboration that's happening between all of our partners and agencies from the federal level, the state level, and even interacting here in our community to make sure that our community is safe. So I appreciate your update and that insight. We want to move to the city of Flint. We do have on the line with us Billy Mitchell, who is the manager of public health. Billy's going to give us an update, and then we'll hear from Dr. Lawrence Reynolds.
Good afternoon, everyone. Can you hear me?
Yes, Billy, we can. Thank you.
Okay. So I just wanted to give some quick updates on what we're doing here in the public health office specifically. We're still doing our water filter and water test kit delivery.
Billy, I think you need to unmute your mic. Okay.
Also.
Okay. All right. We're back.
Can you hear me?
We can now. Yes.
I'm sorry. A call was coming through. I think that's what happened. Also, the Water Payment Assistance Fund, we had over 1,000 residents apply for that program. We are finally through all of our intake. Unfortunately, only about 200 residents have turned in their documentation, which will include like their pay statement or their ID, the proof of residency. So we're considering opening the payment assistance program back up to the residents. We're going to give it a little bit more time to see if residents who already applied are going to maybe turn in their documentation. We are still doing water delivery, and we still have our water pilot going on, which is an effort to get residents to test their water. We have a coordinator at all 3 help centers on Monday, Tuesday, and Thursday. And so what the coordinator does is she still is talking to the residents, getting them test kits, and then following up with them to see if they tested their water. And then she's bringing those test kits here to City Hall so that we can turn them into the state to get the water tested. I think I told you guys before that we do have a public health clerk who is bilingual and she speaks Spanish. So I just wanted to reiterate that. So we have that resource too here at City Hall. The public health office, we're in the office. We have been in the office. We have never worked remotely. So we're here and available to residents. And again, the number is 810-410-2020 for water filters and water delivery. And also we're still doing reconnections for residents who have had their water turned off due to non-payment only.
Thank you, Billy. That is very important information. I know on our line, I'm looking and I see a number of outreach workers and advocates. This information is very, very helpful for them when they're interacting with their participants on a daily basis. Can we now hear from you, Dr. Reynolds?
Yes. Good morning. First of all, I'd like to say health and safety are inseparable. And in response to that, the mayor did initiate a curfew that will end on May 15th. However, between now and then, the curfew continues between 9 p.m. and 6 a.m. And the main point is to encourage people to stay home and stay safe. So if you have developed that habit of staying home, avoiding unnecessary trips, not going out in crowds, continue that habit because it protects your health and it protects the health of your neighbors and others. And pertaining to that is when you go to the store, please just have one person go to the store if that person is physically able to enter. Don't take your friends or family if you can avoid it, because that reduces some of the disagreement and confusion that resulted, unfortunately, in the fatal shooting of that security guard. We can't always control the behavior of our family, friends, and neighbors in their company. So to avoid confusion, just take one person into the store. Please, and I say this every time, if you have a pre-existing medical condition, stay in contact with your doctor, get your medications refilled, and continue to take your medication. And at some point in the future, when we have the capacity to test people who have no symptoms, no signs of a COVID infection, we can start to get a better picture of the impact in our city and in our county so that we can address specific programs to help. And lastly, as we roll out this reopening of our city, county, and state, we will be following the governor's plan, but already within City Hall, we are planning the gradual reopening of services. And I say gradual. And we will have to respond to if there is a peak or an increase in cases and back off a few steps sometimes. So this is not always going to be forward movement. It depends on what this virus does in our community and our ability to track what's going on. So there are meetings to talk about contact tracing, and that is people who will call you on the phone. And actually the state has some of those folks now who will call you on the phone and ask you for information if you were positive for a test and if you have been in contact with someone who is positive. So please, when you get that call from the state of Michigan, please pick up the phone. And I'll stop here today.
Thank you, Dr. Reynolds. Appreciate that insight. Curfew is still going till May 15th. Thank you. We do have a number of our partners waiting for questions from those of you that are in the listening audience today. Please go down to that Q&A button and put your questions in. We will also make sure we'll have an extra 5 minutes after the webinar ends to respond to those questions if we are not able to do so. I want to ask Dr. Deborah Verholden. She is our epidemiologist. She's on the Coronavirus Task Force for Racial Disparities for the state. She's also working here locally. Dr. Deborah, here was a question that was raised that I think maybe you can help with. The statistics that Congressman Kildee cited are extremely concerning. What local measures are being implemented for considered to address the disparities that we are seeing? I think that's an appropriate question for you.
Okay, great. So just real quick, and I need to update this because we also have now stood up a local task force in Flint focused on racial inequities. So we're looking at the disparities that we're seeing and not only trying to implement and stand up strategies to address those things, but even to take a step further back and look at and try to impact what are the factors that gave way to those disparities. And so I do want to say, you know, things for Michigan and for Flint are actually starting to move in the right direction. I'm not attesting that this is the proper metric, but we have greatly ramped up testing both in Flint and in Michigan. And the sort of benchmark that's being put out is when we can consistently, reliably test a significant proportion of our population and those positive results fall below a certain threshold. Some experts have suggested the threshold of 12%. I'm not endorsing that. It's just sort of what the kind of thinking is right now, that will sort of give us a real sense of how the curve is going down and when we can begin to really think about what reopening could look like. But clearly that has to be married with sound, solid, good public health practices to preserve people both in the workspace, in the general market, you know, out in the community. So some of the stats, they all have to be viewed in context. We are actually, you know, people were talking early in this thing about flattening the curve. If you actually look at the increase in cases and deaths, like new cases, we are sort of moving in the right direction. All of us are cautiously optimistic. So we're not saying that we're there, but if we continue to implement and stand up the type of interventions that we need, not only will we continue to see that decrease, but we'll also, with our grassroots efforts, I think, be able to bridge that gap with some of the disparities. It would take me a whole hour to talk about the specific initiatives, but we're working on it.
Right. So, Dr. Deborah, one more question. The testing is being done, but the question is, do you think that testing can be done at agencies and missions? I mean, you know, we're talking about the community-wide testing. Can it be more specified? Is that something discussed?
Very likely that we'll be able to get both in place, and it will be needed as we increase the amount of human contact that people have during this next phase of this pandemic. That's exactly what will be needed. We'll need good community and system-wide testing, and then we'll also need specific site, workplace, et cetera, testing. And I think we should talk about that next week, what that would look like, what that will mean.
Yeah, so we are going to ask you, those of you that are on, we're going to ask you to help us get the word out, because we have for you next week, we wanted to spend a little extra time with Congressman Kildee today. So our panelists that are on, we usually give them opportunity to give us an update. So please put those questions in if you have them for a specific panelist. Dr. Susan Wolford, who is always giving us a clinical update, she's going to be back here with us next week. And as we go to our closing slides for today, we want to, again, simply say to you, the key thing we want to leave us all with is our work that we have to do this week, and that is continue to prevent and protect. You heard it, stay protected. Health, protect your family, protect your community. We will be back here with you next week. If we can go to our closing slide, please. We will be back here with you next week. We have some wonderful participants that'll be with us. We want you to fill out that survey at the end. It's just a quick survey that'll give us some insights of what you think is important for us to continue to cover. But we want to give you a little insight. Next week, we're going to have Consumers Powers on, and we're also going to have Metro Community Development. They will be on because we have a wonderful group called the Continuum of Care in our community. And as we begin to roll out this reopening, there's some things that we're going to need to be put in place. We want you to come back and be with us next week so we can talk about what some of the initiatives are that are making a difference for us. Please submit your surveys to us. Thank you again. We appreciate you for joining us every week, and we look forward to continue to bring to you the best information as possible in the time that we have. We appreciate you and look forward to seeing you again next week.